Hello and welcome to another week of Core Balance Coaching. And this week we're going to do a live Q&A, and I do have some visual aids prepared to help me with potentially answering some questions. And I'm probably going to get into a topic of just kind of diving into lumbar lordosis and the effect that it has on our posture and the rest of the human body, and go a little bit deeper into the effect that kyphosis has on our lower back. And I'm going to kind of work this into some of the questions as I answer them. So we're going to get started with the questions right away because I want to make sure to prioritize you guys and get your questions answered. And so we'll kind of go from there. So let's pull up the chat and just make sure we go ahead and get started. We have at least an hour today to answer questions, and I'll probably go further. I go longer than an hour. And we'll get right into it. So the first one is from Ramesh. It says, hello, I'm in module 8, but still have some pain in the hip abductors, specifically gluteus medius, feeling the pain when doing the back anchor progression. Oh, that's interesting. Okay. Also, when getting out of the car, driver's seat, another pain on my spinal bone in the middle of the lumbar area, feeling the pain when stretching like doing the hip hinge. Any suggestions on these conditions, or continue to do the daily routine? All right, so another pain on my spinal bone. So I'm going to just assume that it would be like, your vertebrae is what you're talking about, right in the middle of lumbar. Okay. All right, so we can kind of break these down and see if I can come up with any recommendations for you. So it doesn't make a lot of sense that you're having pain in the hip abductors with the back anchor progression, because the back anchor progression is mainly using, the marching progression is mainly using the hip flexors to lift the leg. But we are, combining this with anchoring the back anchor to the floor, so the bottom of your rib cage in the back, and you want to be doing that primarily with the abdominal muscles, just as a group to anchor that rib cage down and then march the legs. And a lot of people will use the glutes to kind of help elevate the pelvis, to press away from the back anchor and elevate the pelvis off the ground. So I'm assuming that's how your glutes are getting involved, is from the push away. So what I would suggest is to, try to focus more on using the abdominals as the primary tool for the push away. So to anchor your back into the floor, the back of your rib cage, the bottom of your rib cage in the back to the ground. And so use your abdominals to do that, and then increase their engagement to push away from that back anchor as much as you can, to the point where the pelvis kind of unweights. It doesn't actually have to lift off the ground, but just make it feel a little lighter. And then if you need more help, you can bring your glutes in, and early on, a lot of people will need to do that. That will be just as a matter of strength, needing the strength to elevate the weight of your pelvis or unweight it. The glutes will have to come in. So if you're having pain in the glute med or any of the glutes with that, it would be a sign that there's likely some other issue going on, potentially just overuse of these muscles in general. Maybe they're a little bit fatigued or aggravated, like inflamed from just general overuse during, your daily life. Because this exercise itself is extremely low intensity, right? It's not going to do any harm to the body. So it's more of a sign of something else. Maybe you have a history of an injury to the hip abductors. Maybe there was some tendonitis built up over time from the overuse, or potentially if there was an injury, it could be like a tear or something like that. So that's the only thing, it's not a typical symptom to feel pain in this muscle group, especially with this exercise. So those are my thoughts there. And then so it would be similar, getting out of the car, that wouldn't normally cause pain. So there's got to be some other issue going on. Often it is tendinitis. It's a really common thing. Overuse of muscles leads to just tendon inflammation, which is exactly what tendinitis is. So if that is the case, any tendinitis, you don't want to just completely stop using the muscle. You want to continue to use the muscle, but you don't want to overuse it. So you got to find this safe zone of not using it too much, not babying it, and stop using it, because that'll also make tendinitis worse. And you got to work in this middle range of using it a moderate amount, listening to your body as a guide. So the other thing you mentioned was the pain with stretching. Like if you're doing the hip hinge, you're going to feel pain on your spine. So typically bones don't stretch, so you're not going to, the bone is probably not what's hurting. Typically it's either muscles, tendons, or ligaments that are going to be, you're going to feel sensations from the soft tissues on stretches. And so it's just going to be a sign, right in the middle, there's not a whole lot of muscle right in the middle. So it might be, you can feel your spine, the spinous processes, which is the bony lumps, of your spine on your back, right in the middle. So there's not muscle tissue covering those, but in between each of those spinous processes are some ligaments, like a longitudinal ligament, potentially some tiny little muscles, but I'm thinking more the pain could be coming from your longitudinal ligament getting overstretched, and it would be a sign to me most likely that you are, when we're bending our spine of any sort, and with a hip hinge, you shouldn't be bending your spine at all. So it's a sign that you probably are compensating with some bend in your spine. And so that's number one. So hip hinge, we should be stabilizing our spine with those corset muscles called our abdominals. And so it is not moving. And all the hinge is happening like a door hinge at your hips. But if you are bending through your spine and you're getting pain in one spot, typically what that means is the bend through your spine is not uniform, meaning it's not like a curve that is equal bend through all the vertebrae, which is ideally what you would want. There's probably one vertebrae that's hinging, which shouldn't be hinging. The hips should hinge, the vertebrae should not hinge. And so it's an imbalance, in the amount of motion going into one vertebrae, one segment. Maybe it's L4, L5, which is a really common one, or L5S1. You said yours is more in the middle of the lumbar, so it might be L3, 4 or L4, 5. And bending too much there, and probably there's associated stiffness in the segments above and below. And so that might be worth an assessment, a hands-on assessment from someone like a physical therapist, to just see and push on those segments and see how they're moving. And maybe they'll find that there's stiffness, right above or below this area that's being overused. At the end of the day, the solution is still going to be the same. We want to learn how to stabilize this region with that corset. You have any injury to your body, what do you want to do? You want to brace it. You want to put a like some form of support around that injury for a period of time to allow it to heal. So we we have a built-in brace around our lumbar spine called our core. And so the idea is to use it for that purpose, and then use the hips for their purpose, which is mobility. We have that ball in socket which is designed for tons of movement, and they need to be strong enough to hold the weight of your upper body, of your upper torso, to be able to move through that range of motion. So building hip strength, exercises like the bridge, the hip hinge, deadlift, squat, and stabilizing the spine. This is a theme of the program. So hopefully that helps, Ramesh. And, all of that in mind as you go through the daily routine. You should be modifying the exercises, spending more time here where you know you need it, and stuff like that to react to the listening to your body, which you're doing. And as you're reporting it, you're listening to your body for sure. Okay, Mark Fairchild, we have having surgery on spondy grade 3 on January 6th. Very different than grade 2, which I've had for a long time. And I'm assuming there's more. Also scoliosis surgery along with level 3, 6-hour surgery. All right, maybe we're just sharing about this. I'm going to look a little bit more for a question. In general, Mark, any surgery, you're going to just want to go in as strong as you can. It doesn't mean you need to be bodybuilding or creating inflammation. You want to be just as you've learned over the course of your journey, of your injuries, what your body can tolerate. You want to be building strength, building endurance in your body, in your core, in your muscles, around your spine, up to that tolerance level until you get into the surgery, and get as strong as you can without, worsening the condition or causing a bunch of inflammation as you go in there. But it will absolutely help in your recovery to go in nice and strong. The stuff we do in core balance training should be beneficial, especially for a spondy. So if you have an anteriorlisthesis, which is a spondy that slips forward, we can actually talk about this. I have a visual prepared today that shows a spondy. So if you hang on on the stream, we will show some visuals of that. And core balance training should help that. Connecting your back anchor to the floor, simply that motion would put pressure on the spine to actually correct the spondy, push it more from a grade 3 down to a grade 2. And I guess I can go into that a little bit right now. I do want to make sure and address as many questions as I can. Okay, I see Mark here. You say you're hanging on. Okay, great. So since you're hanging on, I will try to get through a few more questions, and then I will show that visual that I mentioned. Thank you for letting me know. All right, we've got Astral Surfer. I'm dealing with some deep gluteal syndrome. Can the program help resolve it? And will holding the bridge or any other exercise too long make those muscles tighter? All right, so this may be something similar to what Ramesh was talking about. So it just seems like it's the gluteal muscles that you're feeling very tight. Hypertonic would be the medical term, and there's just too much tension in those muscles. This is a reaction of the body. The body has decided, for whatever reason, that holding a lot of tension, tension is the language that muscles speak. It's the only language. So you want to speak the language of muscles, you speak back to them in tension. And right now, the body's decided that it needs a lot of tension in these gluteal muscles to either feel safe or to function, because of something else that's going on. And so usually associated with hypertension or muscles that are holding on to a lot of tension is another group of muscles nearby that are hypotonic, not holding enough tension. So typically this is going to be the abdominals. The abdominals are typically a hypotonic muscle group, and the glutes, especially the gluteus maximus, are also a hypotonic muscle group. But when the gluteus maximus is hypotonic, doesn't have enough tone, isn't holding enough tone, often the deeper glutes will be a compensation, and they will tighten up underneath that gluteus maximus. And so I can't be sure about this. This is speculation, but there are patterns in the body that we're always seeing that's, ends up being consistent throughout the population. And so it is going to be a balancing act. It's really difficult to, target one layer of glutes without affecting another layer of glutes. And so ultimately it's going to be about getting these muscle groups back into balance with each other. The answer to your actual question, I'm not going to be able to specifically give you an answer because it is a really complex inner working. The bridge is going to strengthen and increase tone in your gluteus maximus. And if that muscle needs more tone, then that should help your deep glutes to relax. But the bridge also exercises the deep glutes, where we can't really separate those two. The deeper glutes do have more of a function of abduction. They're more biomechanically just optimized for the motion of abduction, moving your leg out to the side, where the gluteus maximus actually has several motions. But hip extension would be the one that's most in the middle of all those. So, the glute max can do adduction, it can do abduction, and everything in between. And so extension is the one that's in the middle. So I would be focusing on potentially doing some bridging if we want to try and turn off that abduction component, you can put something between your knees, like a ball, like a squishy ball, and kind of gently squeeze it between your knees as you are bridging. And that should turn off the abductors, turn off those deeper glutes while allowing you to exercise the gluteus maximus. And I think that could potentially be a good modification to test out. But at the end of the day, the reason I can't really answer this question is because your body is going to be the only one that knows the answer. It will tell you the answer, and you just have to be listening. And this is true for everyone on this stream, everyone dealing with back pain. The best tool you can develop, the best skill you can develop is how to listen to your body and how to start speaking its language and interpret what it's saying, these sensations that it's giving you, sometimes during an exercise, but oftentimes hours after you've done the exercise. And to be able to feel those feelings and associate them back. So to reflect back and say, all right, I'm feeling a lot of tightness in my lower back muscles right now. What did I do earlier today that could have caused that? Because right now, whatever I'm doing isn't the thing. I do this every day. I sit in a chair or I'll go for a walk or whatever, and this isn't the thing. I know my body well enough that it was something I did earlier today. And so it is an art and a science of trying to interpret the language of your body. And so the specific language that muscles speak are muscle tension. So you listen to that tension, you take it as a message, and you also speak that language back to them. So you give them tension to change their relationship to the other muscles. So what does that mean? With stretching, we're putting tension in muscles, but we absolutely have to include the neuromuscular system when stretching muscles. So we don't just passively stretch muscles, as everyone here may have already found. Just passively stretching muscles doesn't have a lasting effect. The muscles will tighten right back up within hours. But if you add an engagement component, so say you wanted to stretch your glutes, you stretch them in the typical way, but then you engage them in that stretch. You're speaking the language of tension. You're adding a neurological component which is what they need, the communication to your brain, to engage and tense up in that new length, in that new range that you're trying to give them. So you have to speak, and it specifically is not just tension. I can get even more specific. It's contraction. It's the attempt to shorten. Muscle contraction is the attempt to shorten. And so, stretching a muscle passively does add tension into the muscle, but it's not contracting. And that's where there's a big gap. Like it's not speaking the language because you're not including that neuro part of the neuromuscular system. So this is true for astral surfer, Ramesh. You're dealing with the glutes. You want to make sure, if you're dealing with excessive tightness, and you want to stretch that tightness out, not only do you want to be, thinking about the relationship to the other muscles and trying to support those muscles, maybe strengthening the gluteus maximus, and the abdominals and all the muscles around it, but also, if you're going to stretch them, make sure you're engaging them, making it an active stretch in that stretch. All right, we got Nicholas Thill. Hello, I have a spondy and stenosis and a big discomfort in my lower back when I stand or walk. For that reason, I'm sitting on the couch almost all day. I feel better after doing CBT exercise, but as soon as I get up from the floor and walk, the discomfort comes back, so I sit again. Do you have any advice to make the discomfort go away for good? All right, I think that I'm glad I'm reading through some of these before I show my visuals, because this will, my visuals of spondy and just muscle balance and how it affects the body is going to be very relevant to this one too. So Nicholas, if you're here, hang tight, and we're going to get into that. I'm going to read through a few more questions, make sure I get at least some of the way down, and then we will, it looks like I'm going to be able to do this today. I'm going to be able to get through pretty much all the questions, and I'll start this little presentation at 12:30, so in like 3 minutes. So hang tight, Nicholas, and we will give you specific advice about what you're asking. Your question is generally why, or basically, why do I have pain when I stand and walk, and what can I do about it? And we can talk about why sitting on the couch may actually relieve it a little bit, but it's not going to be helping the long-term goal. It's, if anything, might be working against you. So a couple minutes and we'll get started with that. Wendy, how much can losing weight help with relieving spinal stenosis symptoms? That's a really good question. I don't know. I can't give you like a number because I don't even know what units to talk in when we talk about how much. But I think, in general, getting, one of the things in research that seems to be one of the most effective things for chronic lower back pain is just improving your general fitness. And so losing weight would qualify as improving your general fitness, just getting your BMI, if you want to use that, into a healthy range, and improving just general strength and endurance is going to help lower back pain. And it is one of the things in research that's kind of like one of the more successful things, because they don't really have a great solution out there that's being researched. A lot of the solutions are very specific or symptom treatments that aren't addressing the actual root cause. And the closest thing to addressing the root cause of chronic lower back pain is improving the health of your lifestyle, getting a healthier lifestyle, and improving your general fitness and muscular balance. Even for some people can be very fit, but just have super severe muscle imbalances. That would be my situation. But it was a result of, poor form or poor repetitive use of my body in ways that created those muscle imbalances. So in general, yeah, I think it can help a decent amount. Is it going to be the solution? I think you probably would need to do more, but it would be a catalyst to help you along for sure. That would be one of the more sure things I could say, is it will probably help. Didactica. Very grateful to have your program. It's helping me. Glad to hear that, Didactica. I'd like to know your thoughts on getting the disc fluid off the nerve by way of microdiscectomy to aid in faster recovery. Thank you. So my thoughts on microdiscectomy are that if the pressure on the nerve, so we'll call it sciatica, but really it's radiculopathy is the proper term. If that is limiting you from being able to do the actual things that are going to address the root cause of back pain, you know, the long-term solution to back pain, then I think it would be something I would consider. If the surgery would allow you to do the exercises to address your posture and your muscular balance, and you're not really able to do them without the surgery, or because of the pressure on your nerve, because of the radiculopathy, then that is a way it could help you get out of back pain, because it allows you to actually do the real solution. But the surgery itself is not actually the solution at all. It has nothing to do with the solution. It's simply just cutting out a piece of your anatomy that is the result of the problem. It's pressing on a nerve as a result of a bigger problem upstream. So you cut it out, the problem's still there, does nothing to address the root cause, and hence it's in no way a solution. But it does help with get rid of your symptoms, at least temporarily, ideally. And then you can then use that as a starting point to address the problem, which in my view is, you know, what we talk about this, muscular imbalances, lifestyle, lack of support for the spine, lack of use of your abdominal muscles. And so let's talk about that. Let's talk about, I'm going to go into my little visual presentation here. Let's talk about how muscular imbalances can cause back pain. And let's talk about how they can lead to all of these different symptoms and diagnoses that we see here, like sciatica, radiculopathy, you know, herniated disc, bulging disc, spondylolisthesis, stenosis. How does something like muscles being out of balance with each other actually lead to this? And so that's what I want to show. What I would love to do is give you guys a really big visual. So if you guys don't mind just giving me a second to try and figure this out, I'm going to try. Oh, here we go. I'm going to try to give you guys a bigger view than my normal split screen. Well, let's see how this goes. All right. Oops, ruined that. There's Student Hub Student of the Week. We will announce that later. All right. How's this looking for you guys? Not good. Something like that. All right. All right, I think this will be good enough. So we're talking about muscle imbalances. This is a picture of muscular balance. And we have pictured here the glutes. We have the abdominal corset that I love so much. We have the lower back muscles here, and we have the hip flexors. This would be the TFL, and this would be the rectus femoris. They're all in balance with each other here. And this is a squat. So this program I'm looking at right now is called Muscle and Motion, and they use the squat to assess postures. You can also see some hamstrings here, but we're mostly focused on the glutes, hip flexors, abdominals, lower back muscles, and they're all in balance with each other. They're all the same color, whatever color that is, a light purple, violet-y thing. So we're going to go forward. I'm going to play this, and we're going to see imbalance. Okay, so now this is a typical pattern. The glutes are hypotonic. They've lightened to like a lighter, almost white color. Abdominals, hypotonic. Now we have dark purple here representing hypertonic. And the lower back muscles become hypertonic. What this has done is this has rotated the pelvis forward from here to there. The belly bulges, and we're going to look deeper into what actually happens in the spine. This is like very, very related to a spondylolisthesis and stenosis particularly. And so this is what I want you guys to keep in your mind as a visual. And it's just talking about the different muscles. I don't think there's much more. Oh, you can see the arrows here. So this is the forces being caused on the spine. Pelvis tips forward and is lifted up in the back. All right, so let's go to, let's look at this. We're going to take a look at what spondylolisthesis what's actually happening here. So we're seeing the sliding forward of the L5 vertebrae on the sacrum. And then we're going to relate this result, this end result, to the posture that we just looked at. Okay, so let's get another view of this. I'm letting this kind of play through. Oh, okay, that's all it's going to show. So that's sliding forward, spondylolisthesis. You can see that the entire lumbar spinal column shifts forward together. So it starts back, and it all shifts as one unit, where the only movement is taking place at one vertebral level. This is kind of a breakdown point. You can think of like the weakest link in the chain happened right here. So this is the chain, and it only takes one weak link and it's going to break down there. And then this becomes very stiff together, and then all the movement happens through here. So we're going to go to just take a look here at normal postures, and we're going to take a look at what actually is lordosis. So we saw those muscles, the hip flexors pulling tight, tipping the pelvis forward. We saw the lower back muscles tight that were lifting up on the back of the spine here. All of these forces are basically causing an increase in the curvature of the lumbar spine. And that's really what's happening. The lumbar spine is being pulled taut like a bowstring, or like a bow and arrow, you know. It's the bow that's getting bowed out because of tension in these lower back muscles here, getting tight right there, and the hip flexors also tipping the pelvis forward. And we're going to take a little bit more of a look at that as well. And so when that happens, you can see that, and this is going to show normal conditions, so we're going to skip through that. I really liked this view here. You can see that the space between the vertebrae is getting closed down. It's going to compress more on the back of the discs, which will cause things like herniations or bulges. It's also going to close down the space just in general where nerves come out, which we call stenosis. And so all of these conditions are just results, similar but slightly different results from an uproot cause, an upstream cause that is just this monster called muscle tension imbalances. And so another thing that happens, we talked about, I mentioned we were going to look at the angle, is the angle of that the lumbar spine sits on of the sacrum changes. So this would be a normal angle, 40 degrees. It's a normal angle. When we go into lordosis, because of those tight lower back muscles, because the pelvis is getting tipped forward, that angle also tips forward and it goes higher than 40 degrees. And this is going to cause conditions in the lower back. And so if you imagine, so we have the pelvis tipped forward, the sacrum tipped forward, we have forces bowing the lumbar spine forward. All it takes is for one of these segments to break down. And instead of bowing like a uniform bow, it starts to kink. And that's what we call spondylolisthesis. Spondylolisthesis allows for, instead of just bowing to happen, the force actually breaks down one of the segments and it starts to slide forward instead. So this would be flat back, a less than 40 degree curvature, which in my opinion would be helpful to someone who has spondylolisthesis. That would be my goal. And actually has been my goal. As someone who has a history of spondylolisthesis, I want to reduce the forces, reduce those forces that are trying to bow my spine forward or pull it forward, from those hip flexors pulling it forward, those lower back muscles bowing it forward. I want to reduce those forces and I want to move towards a flat back posture, because then there's less reason for my spine to slide forward. And so that would be my recommendation to Nick and Mark, who are both dealing with this, is to look at it this way. This is biomechanics. This is physics. And if we are going to take advantage of our knowledge of physics, we want to reduce the forces that are pulling the spine in those directions. Okay, and we have another one to look at here. This is really, I mentioned earlier, I think it's, let's see, we looked at that one. All right, we're going to look at this one here. This is another element that is a factor in posture. And so for Nick, this might be a reason why standing up is very bothersome. We're going to look at now kyphosis, the kyphotic posture, which is the upper back posture. So part of these muscle imbalances is kyphosis, which is the forward curvature of the upper back. And that's from tight muscles. The similar syndrome called cross posture syndrome in the front. The chest muscles tighten up and pull the shoulders forward. The upper back muscles in the back become hypotonic and they're not holding us up. It creates this kyphosis. And so you can see, I'm gonna break this down, but you can see that there's going to be a compensation in the lower back when we have too much of this going on. So you can see this is a pretty healthy posture. That's like military posture there, but this is us going into kyphosis. And that forward head, rounded spine posture is going to require, especially in certain motions like the squat, even for some people just standing and walking, it's going to require that the lower back go even further into an arch. People with kyphosis, hyperkyphosis, too much forward curvature of the thoracic spine, have a hard time putting their arms over their head because you can really look at this as it's kind of as if somebody always is always bent forward in their upper back. So if you're always flexed forward in your upper back like this, then you're rounded forward, then raising your arms all the way up is actually going to go to like right here, because you're bent forward in your back. And so having a hard time putting your arms overhead is a sign that you have too much curvature here. And then the correction so that you can look forward, so that you're not looking at the ground, so you're not always bent forward completely. The correction happens down below and also in your neck. And so it requires, you can see now that somebody even arch even more through their lumbar spine. You can see it in the squat here. So this would be hyperlordosis, too much arch in the lumbar spine, because they are too rounded forward here. You can see this blue curve here is the kyphotic posture. If they weren't so rounded here, then they wouldn't have to arch so much here just to stay upright, just to look forward. And so by opening up this kyphosis, this thoracic spine, allows less curvature. Now we're going to watch the lumbar curvature correct. It allows, we'll go back to the beginning. So this is a nice lumbar curvature here, but you're having to correct an arch in the lumbar spine to look forward. So if we can correct this hyperkyphosis, it allows for the lumbar spine to correct and be more in a neutral position and not so much causing all of those conditions that we talked about before. And so this is really kind of what I wanted to go over today. Here's just another example of this same thing. It's a really common compensation in all of us, is just this hyperlordosis posture. Okay, so hopefully that just helps give you guys a visualization. The end goal, what do we want to actually accomplish with all of this? What is the goal? It might feel like a lot, but it's to stabilize that lumbar spine, so it's not having to arch and bow so much, and it's being supported by the muscles around it, and mobilize the joints above the thoracic spine, so the thoracic spine can do some of the extension and the lumbar spine doesn't have to, and the hips, so that the hips can do most of the motion that we need for mobility, like walking or squatting, and the motion doesn't have to go into the lumbar spine. And if we can build strength in our hips and build mobility in our thoracic spine, or gain mobility in our thoracic spine, then the lumbar spine, then the muscles around this whole thing called our torso won't have to compensate by tightening certain ones. They won't have to turn off certain muscles or become hypertonic, hypotonic. The balance of all these muscles happens in a kind of almost a natural way, without having to specifically stretch this muscle here and stretch that muscle over there and tighten this muscle like we're individually tuning guitar strings. Because now that I have mobility in my thoracic spine, my lumbar spine doesn't have to do that anymore. So all the muscles around it kind of correct themselves. And for example, we talked about Nick. So you mentioned that you spend a lot of time sitting, and sitting does take tension off of those hip flexors. It takes tension out of those hip flexors, which means that they're no longer pulling on the lumbar spine. So that's going to offer relief. But the lifestyle of sitting is actually training those hip flexors to remain in a shortened position. And so it's keeping us in the cycle. But walking hurts, so I can't walk. And so I have to sit. And so this is the cycle that it seems like you're stuck in. And so I think we have to live and operate somewhere in a gray area in between sitting and walking right now. And that might be spending a lot of time on the floor, getting down on that floor, using the floor to help align our spine and engage those muscles that predictably tend to become hypotonic, those abdominal muscles. We can get another view of that here. These muscles here. Move this back over. So we want to use these abdominal muscles to engage and bring that rib cage back. What happens when we're bringing that rib cage back? It actually is correcting this hyper lordotic curve. And so being on the floor is going to be a fantastic middle ground for you to be able to improve your posture. There we go. Now the rib cage is brought back. It will be connected to the floor here. And we can see the yellow line could represent the floor. Now the back of the rib cage is connected to the floor. The pelvis is connected to the floor. There is still some healthy arch in the lower back. And we're engaged. We're increasing the tension, neuromuscular tension in these muscles, which is going to help restore balance all around, because the lower back muscles will be reciprocally inhibited through that. And so that will be my advice for anyone that's struggling, is understand how the muscles interact with the posture and how the posture interacts with the end result diagnoses that we come home from the doctor with. And if we, instead of treating the diagnoses, we go upstream as far as we can. And yes, the muscles are upstream, but we could go upstream even farther and say lifestyle. How do our muscles get shaped? Well, the way that we live our life, right? The way that we use our bodies shapes our bodies. And so if we are sitting a lot, our body's going to be shaped like a sitting position, which is the fetal position. Fetal position tightens hip flexors. Okay? Hip flexors pull on pelvis. Pelvis rotates anteriorly. Lumbar angle increases beyond 40 degrees. Lumbar spine becomes bowed, causes anterior forces that cause things like spondylolisthesis. And we can connect the dots. So should we treat the spondylolisthesis? Should we, at a certain point, you might have to. You might have to. Some people, it might be too far gone, and a metal cage might have to be screwed into the spine, and that would stabilize this. But regardless, or maybe it was a herniated disc that you get cut out, regardless of treating the symptoms, we still need to address the root cause so that it doesn't happen again, so that we can address the actual problem that caused it in the first place. And the way that we use our bodies is the farthest upstream thing we can do. Use your body in a healthier way. Can't do that yet? Get down on the floor and do some really gentle engagement stuff and spend a lot of time doing that. Spend hours a day working on restoring balance. And the bridge is another great thing. And maybe you'll be able to get up and do some walking. And if you can get up and do some walking, at that point, that's a major breakthrough. Then you can, walking itself, you can use walking as a muscular balancing tool, because walking itself is one of the best tools for restoring balance in the body. And it's going to naturally restore balance in the abdominals, the glutes, the lower back muscles, and the hip flexors. It's the most synergistic motion that the body does. So you want to get to the point of walking. And then once you can walk without pain, you want to use walking as a tool to continue to restore muscular balance. You could walk an hour or more every day, and it would be only beneficial to you. Assuming there's no other problems going on, like foot problems or anything like that, it would be only beneficial to your lumbar spine if you can get to the point of muscular balance enough so that walking doesn't hurt, so that you can stand up straight without putting too much pressure on a nerve. We got to get to that point. And so using the floor initially is the way to do that. So that's the spiel that I wanted to show. I think it is really important to just understand the anatomy to the point where you can connect the dots between the forces that are at play, so that the result that you come home from the doctor with, which is a diagnosis, doesn't feel like it's so abstract and just where did it come from? Well, it came from forces like this. It came from physics. And physics makes sense. Physics is logical. And so if we reverse engineer the problem and do everything that led to that problem, do it in reverse and try and restore where you came from, we can get some of that, if not all of that function, back into a healthy place. All right, so I'm going to get back to the chat and answer questions. All the questions that I can. I did spoil the Student Hub Student of the Week, so let's go ahead and do that. This week, it is Elisa Lamphere, and we're recognizing you for your dedication and active participation in the daily challenges. By engaging with these additional resources, you help create a positive and supportive environment for everyone. Thank you, Elisa. And we're honoring you by adding a month to your membership. You have to do nothing. We'll add it from the back end. So congratulations, and we hope you inspire other students to do the same. All right, so let's get back into this. Hopefully that was helpful for you, Nicholas. I am going to scroll down and just see what's going on down here at the bottom. Thank you, Didactica. And it looks like we have a relevant question. So someone with anterior pelvic tilt should not use a lumbar pillow that enhances lumbar curvature, correct? I've wondered about this often. So this is so cool. I love when I see people thinking about stuff like this. There are so many back pain tips out there that are just given out as a general thing. Oh, you got back pain with sitting? Use a lumbar roll to under your lumbar spine when you're sitting. It'll increase the curvature and it'll support your back. Well, let's think about that. Does that actually make sense? If I'm suffering from excessive lumbar curvature, should I prop my spine into a place where it is forced into that problem, curvature? That doesn't make sense to me. And so, I think so many of us go through the beginnings of our back pain journey following advice like this. Stretch your hamstrings, use a lumbar support, all these other things that I don't even want to name. And we just do them because that's what people tell us to do them. And then at some point, and like I did this too, I stretched my hip flexors to the end till the cows came home. And at some point, I started causing new problems and worsening my condition with these tips. And you have to start thinking about it. Oh, shoot, does this actually make sense? Does this really help? Are these boilerplate tips from people? And it's when you start thinking about what you're doing that you have just broken through. And this is when I broke through. And I did say, stretching hip flexors hurt me. Yeah, because I was passively stretching my hip flexors, which is the hip flexors are attached to the lumbar spine, right? So you pull on them, you pull tension in them, it's going to pull that lumbar lordotic curvature even more. And so what you need to do, yes, you need to lengthen your hip flexors, but just passively stretching them is not the answer. You want to engage your core, protect your lumbar spine, and actively use your hip flexors in a lengthened state, which is the bridge. Okay, just the bridge is the way that we teach that, and we also teach the kneeling push away. So yes, you want to lengthen your hip flexors. I just want to clarify that stretching them is not the way to do that. You can cause SI joint problems. That's what happened to me. I broke down my SI joint by doing that. So that's a very good question, and I'm glad you've wondered about it. And if it doesn't make sense, don't do it. I would be doing the opposite. If I had something like a spondylolisthesis, I would be pressing my back anchor, what we call the back anchor in core balance training, into the chair to correct that force that's pulling my spine into a spondy, into a lordosis. So Mark says, so one can go from a level 3 to a 2, having MRI December 23 to see if any improvement. Yeah, I believe wholeheartedly that you can reduce the grade of your spondy. It is possible. I'm not going to say it's guaranteed or anyone can do it or any condition of spondy can be reversed. No, there are any number of severities of spondy. There are any number of types of people, lifestyles and things that may prevent that from happening or hinder that from happening. And but what I will say is I 100% believe it is absolutely possible to take an instability, which is just the forward movement of a vertebrae, and we know that it's movable, right? This should make sense because it's moving, to move it back in the opposite direction. I could do that right now in a short-term way by laying over a pillow over my abdomen and put that pillow pressure right underneath the spondy location, and the force of that pillow is going to push the vertebrae. So that's a short-term relief method that I would recommend, but you lay on a pillow long enough and you use your abdominals as a blocker to pull that back in. I want to keep referring back to these images. These are forces happening, right? These are forces that are happening at where did we go? Am I still here? Yeah. Okay. Sorry. These are forces happening at the lumbar spine, but if we look at what we have as a tool, we have a wall. It is actually called the abdominal wall. I need to lower this. This is actually the abdominal wall, and walls block things. So getting more engagement in the abdominal wall, instead of having this, a total breakdown in the abdominal wall that allows things to slide forward, we learn how to engage that abdominal wall and prevent that. Then we are just using physics back in our favor. So yeah, long answer, yes, 100%. I believe that you can do that. I've actually had multiple students who have come to us and reported that they've had changes in their MRI from things like reduced stenosis or reduced, I believe we had one student recently tell us that they've seen multiple changes in their spondylolisthesis in MRI from multiple MRIs. Sometimes it's worse, sometimes it's better, and that's just a sign. This is an instability. It's exactly what it is. It's unstable. And so we need to stabilize it, and we have a corset built in. For a lot of us, that corset is inhibited. It's kind of turned off, but we can reactivate it with our neuromuscular system. And and you can stabilize it. If you're wondering about the possibility of your abdominal corset to do that, then just go to the store, go get a CVS and get a corset brace and strap it on around your waist really tight and then breathe into it. It's going to feel really good. You're going to feel really stable. You're going to be like, awesome. I'm going to wear this every day. But the problem with that is there will be a dependency formed on it. Your abdominal muscles will absolutely get weaker as a result because they are no longer needed. And then it becomes potentially a bigger problem. So you could temporarily use a corset brace, an external corset brace, to help you get on track, but you want to wean off it as soon as possible and turn those muscles that are shaped exactly the same way into your new corset brace. All right, back to the chat, and I want to make sure I didn't skip anybody. Got to respect that. So we're scrolling back up, and we're back to Wendy H. Also, will the exercises help with radiculopathy? Absolutely. So radiculopathy, we have actually talked about that on this stream a little bit, and I need to do something here real quick. Sorry, guys. Something is playing in the background, and I can hear the audio. All right, I'm back with you. All right. So radiculopathy is nerve root compression. And, if we just look at that posture that we were looking at before, this is a great way to compress nerve roots, right? There's nerve roots. And if we compress the back of the vertebrae through our posture, you're going to see it right here. Those nerve roots are going to get compressed. So the question you're asking is, can you open up your posture? Can you reduce the amount of curvature in the lumbar spine? Because if you did that, then as we just saw, the spaces between the vertebrae can restore or increase, at least to some degree. So this is normal curvature. Increased curvature, we see the spaces between those spinous processes. Look how close together they touch, and then it reopens back up, and it's the muscles that are holding us in place, right? We saw the length tension relationship between all the muscles, and we can change. That's the beauty about muscles. We can change they are dynamic biological tissues with nerves that control their tension, and we can speak their language by putting tension in them and training them. Specifically, we want to put tension in the hypotonic muscles, and that will, by a really cool thing called reciprocal inhibition, release the tension out of the hypertonic muscles. And so yes, you can restore posture and take pressure off of nerve roots, which is radiculopathy, and that's often confused with sciatica, but it's nerve root compression, right? It's same things, leg symptoms, same feelings as sciatica. All right, so talked about that quite a bit. Here we are, Rybit. I'm stuck on day 4 of the program. Tried doing it for 3 days in a row and have now kind of given up. I feel the principles of your program are what I need, but the video instruction isn't very clear. I don't know if I can be successful without feedback. I can't tell what you're doing lying there, and it's not helpful for me to just have the intention. I can't do the pelvis tilt thing. Confused by the instruction, I've ended up just feeling pain trying to push out. All right, so let's talk about that a little bit. I don't have immediately in front of me the video, so it's going to take me a second to open it up. But I'm going to do it because I think it'll be the best way to talk you through this. I don't want you to give up, Rybit, because I also believe that this is probably a good place for you to be. So I'm opening the course and day 4 right now. Back anchor progression. Okay. So I'll bring you over. Let's see if we need to do this. I think this will be better. And so we're laying here and it's like, what the heck am I doing? So this is a progression. So the first thing you want to have done and spent a lot of time doing is the back anchor awareness, which is, I believe, day 2. Day 2 is where we go from rib cage flaring. I don't know if I show rib cage flaring here, but right now my rib cage is not flaring. So my back anchor is connected to the ground. And so I'm already connected. This is a progression from day 2, back anchor awareness. We have a nice flat line here. So that's good. I'm using my abdominal engagement to hold my, there it is. That's bad, right? So that's where often a lot of us are starting out. You probably realize that. You lay down passively, lay on the ground, you're going to have your rib cage flaring up. It's also flaring in the back, not touching the ground. These are things I'm just repeating from the video. So we're going to engage our abdominals, pull it down, connect the bottom of the rib cage in the back to the ground. So we're there. That's day 2. You said you are stuck on day 4, so it means I'm going to assume you've got day 2. So now what we want to do is we want to engage even further in just that same motion that you just did. No different, is to press, is to bring that rib cage down. We're going to do that even harder. So turn that intensity up. So you can turn it up to 100% if you want. And just same motion, press even harder into the ground. So you now brought it down and just touched the ground, and then you're just going to bring it further into the ground and press into it. Well, when you do that, this becomes a fulcrum, and something somewhere else is going to lift up. You press a fulcrum into the ground, something's going to lift up. That's going to be the pelvis. If you don't have enough strength in your abdominals to do that, that's okay. You don't need to push out. I don't know what you meant by pushing out, but you don't need to push out or compensate by doing anything like aberrant. You want to stay in the lane of having that simple intention, and it is intention because we have to maintain that intention of rib cage down, touch the ground. Now, intention remains the same, push further into the ground. And we're learning how to engage our abdominals a little harder and bring that pelvis forward, which is in itself, anybody with a spondy listening or stenosis is going to reverse the forces. It's going to be the opposite of the forces. Now the pelvis is coming, the entire pelvis, pubic bone and everything is shifting forward. It's going to reduce the bow in the spine. It's going to reduce the forces that are pulling this, causing the spine to go like this. We're taking the bow out of the spine in a healthy way. So abdominals pushing down even further. Okay, don't have enough strength to do that. What do? I'm not accomplishing the goal. What do? You can then bring your glutes in and help out with your glutes, because your glutes, I would bet, are strong enough to squeeze your glutes, and you can even, gently push into your legs a little bit and just gently just elevate that pelvis off the floor, like unweight it. It doesn't even have to lift off the floor. It can just be light, feel lighter against the floor. So there's less pressure of your pelvis pushing into the floor. But the key is that back anchor, this bottom of the rib cage in the back, which is right here, is still connected. That's the difference between this and the bridge. So this stays connected. This is the fulcrum. We're pushing away from it with both our abdominals and our glutes, and the pelvis just becomes a little bit lighter. If you can do that, you've accomplished the lesson. This is not a big, crazy movement. It's a very subtle, simple movement. And then you just learn how to breathe. And your pelvis is a little lighter, and you're breathing with the engagement. This is exactly what I'm doing. It's hard to tell what I'm doing because I'm not doing much. I'm just engaged and I'm breathing. And this is the boring process of the journey out of back pain. The journey out of back pain does not involve extreme things. It does not involve doing yoga moves and chemicals like pills and injections and surgeries. It does involve learning how to stabilize your core so that you can then go do yoga moves without hurting your back. But there extreme exercises or, like with large amplitudes of movement or high intensity things are likely what got us into this place in the first place. And so we have to do the boring stuff. We have to do the stuff that we haven't done before, which is just like, all right, how do I stabilize this spine? I'm going to engage it. All right. How do I learn pelvic control? It's called lumbo-pelvic rhythm. How do I learn that rhythm? Well, it's very boring stuff. It's like, well, babies had like a year to do this. At least 6 months to a year to learn this control because they were just laying on their back for that time. Well, that's how we did it. We were laying on our back. We were lifting our pelvis off the floor. They can do it very easily. And they are developing that core strength. So it's the boring stuff. It's not a lot of movement. And then, you can, if you get strong enough, your pelvis can elevate off the floor, like what is happening right now. There's a little, maybe 1 inch of space between the back of my pelvis and the floor. That takes strength because I'm lifting weight, right? My pelvis and my upper legs, they have weight to them. So my abdominals and maybe a little bit of glutes are lifting weight now. All right, now let's see if we can add the next step, which is, all right, can I learn independent limb control, limb movement while maintaining this connection? That's another layer on top of this extremely boring, not very much happening, very simple exercise. Simple but not easy. Don't get that confused. It is very simple and boring, but it's not easy. And the hardest part might be how boring it is and how it doesn't feel like you're doing enough, doing much. But I promise you, and you've probably already learned this yourself, going to the gym or some class or some program where you're doing lots of big crazy movements without this control, this core control, this spinal control and support, is how we hurt ourselves. So we have to break it down to the most basic fundamental stuff first and learn how to develop spinal support and control. Then we add movement to it. And this is what we're doing in this exercise. We're beginning the process of adding single limb independent movement with maintaining of that core engagement. All right. Nice work, Ryan. Thanks. All right. So hopefully that helps make sense and explain things for you, Rybit, to just help you accomplish the goal. And guess what? Yeah. So just clarify, there is no pushing out of intention. And I use the word intention because I don't have a better word, but there's no goal of pushing out. The goal is pushing rib cage down, just to clarify that. So you might have to reset, rewatch even day 2 back anchor and just like clean slate, start over. And a lot of people have to do that, but it's a weird thing to have to do this stuff and learn how to control and support and engage the muscles around your spine. All right, we got Ariana. I have a desire to scroll down, so just see what's going on at the bottom. All right, we got some comments from Mark. Oh, okay. Oh, he was disappointed, but I just spent a lot of time on his question, so I will, somebody needs to let him know. We don't know who Rybit is. That's the problem. we could find out who Rybit is, we could let him or her know that I spent a lot of time on that question. All right, so going back to, where are we? Gosh, I got lost. Here we are. Ariana. Hi, doctor. How are you? I'm doing pretty well. I am almost 3 months into SI flare-up. It started back in August. The first 2 months were quite intense. The last one has been on and off pain. Is this normal? I get discouraged some days because it seems I am never going to stop hurting. Thanks to you and all CBT team. Really good question. I appreciate the question. And so you started in August, so September, October, November. So we are in the third month and it's been quite intense. On and off pain is a good sign because if we, let me switch back. Okay. If we have days that are better than others, then we know it's possible that they're possible. So that's much preferable to someone who doesn't have those days. And I absolutely believe that if you can have a better day than the day before, then you can have another better day that is better than the better day. You can build off of better days. And if you can build off of better days, then there is no limit to what you can accomplish. The only person that I would say, I don't know if you can do this, is someone that has continually had a decline in everything. This is like every day is worse than the day before. I'm doing the things, I'm doing core balance training, I'm doing everything that I know that to the best of my ability, and I haven't had a better day. Then that is a hard answer to give. But if at any point you have made it possible to improve on the day before, then everything that I just said goes out the window. I believe wholeheartedly that you can do that again. And those days that are better are often a result of something you did right. And if it were possible to have a perfect day for your back, and know that perfect day that you just had would make the next day feel better, then that's what we should be striving for. We should be trying to make every day as close to the perfect day for our back that we can. And I know we have to go to work and we have to do things, but we can modify those things. We can take micro breaks and stand up and give our spine more time to decompress from sitting at a desk. And we can modify to the best of our ability the things that we don't have control over. And then on weekends or days off, we can just try and design our day around having a perfect day, because getting over that hump, getting over that rock bottom or whatever it is so freeing, because every day after that, you can have a little bit more wiggle room to do life and to do things that help you. So this is what I have to say to you, Ariana, is the on and off pain is the hope. That's the hope. And so I know your name is so familiar that I'm confident you're familiar with all of the SI joint content. But if for some reason, if not, the belt, the SI belt is a good tool, but also the belt around the thighs, pushing out into it. And that YouTube video shows it, and the lessons going into the program someday soon. We're still in processing with those. Using the belt around the thighs is a huge stabilizer for the SI joint, and then avoiding the things that are hurting it. Especially with the SI joint, you got to shoot for perfect. You got to shoot for perfect days. and try to have 2 of them in a row. Try to have 2 better days in a row, and you can prove to yourself that the words I was just saying are true. And this applies to back pain too. You want to try to have 2 better days in a row, and then you have broken out of a plateau. Because if you can do it 2 days in a row, you can do it 3 days in a row. This just takes work. Okay, fatigue in the gluteus medius. Yep, fatigue is a sign of overuse, so that would be in alignment with what I was talking about in my answer to you, Ramesh. Nancy Huber, hi, I'm having hip replacement surgery on November 23rd, and will be out of commission for several weeks relative to CBT, currently in Module 7 with lots of regressions. What is the best way to step away? No, continue. Oh, as in get away from the barrage of emails. Just email the customer support and let them know, and they can take care of you whatever you prefer to do. The emails should only come if you don't complete a lesson. You'll get reminder emails for like 2 or 3 days, and then it will stop. So you can just know that it will stop after the second reminder email or the third email. And then that's how that works. And then once you want to start the emails up again, you just complete the lesson, and then it will trigger the next lesson set of emails. So that's how that works. All right, fantastic, Mark. Glad to hear this. And I think I already read these. And yep. So Pragya, I'm processing well with the course, but I hear a clicking sound in my hip flexor, especially while doing back anchor challenges. Would you have any advice for me? Yes. So that clicking is probably the snapping of a tendon over your AIIS. It's called snapping tendon. And we aren't too concerned with it unless it's painful, and don't intentionally try to reproduce it. It is a sign of just like hip flexor tightness or a little bit of an imbalance, and it does correct through the muscle balance that we are restoring in our body. So it should be getting better. I don't recommend reproducing it on purpose. So if you can when you're doing the back anchor challenges, just stop short of that click. When you're extending your leg, stop extending your leg just before that click were to happen and pull your leg back. And that is what I would recommend. And the goal over time would be able to extend your leg further without the click, maybe even a millimeter further, but you would be able to call that progress. And over time, you can potentially get full leg extension over months without the click happening. Deborah, thank you for these live chats. They are such an important tool in our journey. You're very welcome. Thank you, Deborah. Juan Restrepo, what are your thoughts on running with a disc bulge? I gave up because of sciatic pain, but I want to get back to it. I have mixed answers and don't know what to do. Really happy with the course so far. I get this question from time to time. I believe I had it a couple of weeks ago. I absolutely believe that you can get back to running with and the disc bulge is not really going to be a factor to me. The disc bulge is just another symptom or result of this back pain syndrome that we're all struggling with. So it could be a disc bulge, it could be a disc herniation, it could be stenosis, it could be various different diagnoses. It doesn't really matter unless it gets to a degree of, very severe. A disc bulge by definition is not going to be severe, because if it were severe, it would just herniate. So it's just not going to be a huge factor to me in this. And I think that, you were having sciatic pain, meaning that bulge was pressing on a nerve. But that is something that does change and will change through the postural changes that you're making in your body. There will be a day when that bulge is in a different place or moved or progressed or regressed, and that nerve is not in the same place and is just not hitting the same way. And so this is guaranteed, because all we know that is guaranteed is that our bodies are going to continue changing as we age, as we make changes to it. So things are going to change. And so I'm just saying this to encourage you to keep trying, keep doing the things that are helping. You said things are helping, so keep doing those things. Don't give up on running. Start walking, then start speed walking. Work on that core engagement with the walking. And then when you feel ready, start moving into a slow jog. And running is not the cause of this sciatica or the disc bulge. It's the muscle imbalances that we talk about. So don't look at it that way. Don't look at running as a bad thing or a problem. It's just learning how to engage and hold your body while running. That's going to be the game changer for you. So yes, you can get back to running, and you should start now. Start by walking, and start by walking faster, and then see if you can get into a light jog. All right, we talked about that one. Anurada Verma. Hi, I am just 2 weeks in the program and see results. I am aware of my posture. I have sciatica and stenosis. A double whammy. Sticking with the program until I get better. Awesome. Great to hear. Thank you for the kind words, Didactica. All right, so this one bums me out a little bit. So we got to we need to message this guy, Rybit, and let them know that we answered their question. We got Mark. My neurosurgeon saw MRI, asked me how I am able to walk. Okay, yep. That is often, it's not often, but it's something I've seen where, imaging can look so bad and you're like, how is this person even functioning? But they do, and the body adapts. So it's one of the big reasons why I'm not a fan of using imaging as a determinant. It can be a tool, especially for surgeons. It's their best tool to know to plan the surgery. But for us, for me, it can be a tool to help, but it's not really a game changer. It's not going to really change much for me in my approach. It's the way that your body is feeling and communicating to you, because often that does not align with the imaging, and the way that your body is functioning and feeling is much more important. Also, imaging is a picture that's taking place at a specific time when your body is in a specific position. So you get up off that table, that MRI table, your MRI would look different if you were in standing. So maybe you're more functional in standing or whatever. There's just so many things about imaging that I don't use it as my determining factor. You're very welcome, Mark. Thank you. And we have hollow body ab work. I don't know that. I do not support abdominal hollowing. So that technique of abdominal engagement is not something I support, but I don't know hollow body ab work. Oh, thank you, Asti. Yeah, you can click on go to their channel and just message them probably, or something like that. Pragya Sharma, you're very welcome. Nancy, just for the record, my back and SI issues are secondary compensatory to my non-functioning hip joint. My ortho does want me to continue this program after that is fixed. Yeah, so that would make a lot of sense. The hips need to be functioning well to have a healthy spine, so it does go up the chain. And so work on that hip, get that hip back. The bridge should be helping the hip. And so you need that hip to be able to have a healthy spine. It sits right on top of it, right? So then Ariana, you're very welcome. Yeah, so Ariana, I think you're the last one, and it's about an hour and a half, so great. I just want to say, it's SI joint is a long game. And you've probably heard me say this before, but the reminders are good, because any injury to a joint ligament is a long injury. It takes a while. So even a setback is the same thing as the original injury. It just sets you back. It's just re-injuring that ligament, and it sets you back, right? So any injury, so your knee, MCL, ACL, how long does it take to recover from those? ACL, 6 months to a year. At the fastest, probably more like a year to a year and a half. These ligaments take longer to heal. And the SI joint is just a ligament heavy joint. It's not like an injury to the lower back, which could be a muscle injury, heals a lot faster, or an injury to even like a disc. A disc actually can recover relatively quickly because it's not a typical ligament. And so it's the typical like joint where it's connected by a ligament, like an SI joint or a knee or a shoulder, where that ligament, that connection between the joints, it gets compromised, and we still have to use the joint. So it's continually getting stressed while it's trying to heal, especially the SI joint. So just look at it as a long game. Be patient with it. Use the SI belt to stabilize it when you can. Wean off the belt. Do the exercises to support and strengthen the muscles all around that. And have a goal of a year from now. Because that, unlike a knee or an ankle or a shoulder, we can't put in a brace and stop using it. You have to continue using it. And the best thing we have closest to a brace is strapping a belt around it, but it's still going to be in the middle of your body. You can't get on crutches and avoid using it. So it's just a longer game. And being okay with some pain is a helpful thing too. Just being, okay, I'm okay with a little bit of pain. I'm going to keep doing the right thing, and I'm going to keep getting back up. And so that's my best advice for you. All right, everybody. That was a full stream, and I appreciate you all showing up and leaning into your health. Just makes me want to lean back even further. So I'll see you again next week. And until then, make sure you get down on that floor and connect to your core. All right. Take care, everyone.